Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. And we're very happy to have two guests with us this week, Sierra Drevline, Director of Employee Health Services for Masonicare, and Courtney Wood. She is the Long-Term Care Administrator of Masonicare Health Center. Thank you all for being here today. Courtney, I thought we'd begin with you. As the number of COVID cases in the greater community grew, you and your team there have also been facing an uptick in cases. Can you bring us up to date on the situation there now?
So yes, we have had an uptick in the building with our cases, some with staff, some with residents. It's across the board. Fortunately, this time around, it's not as drastic as it was last time. We're not seeing the signs and symptoms that we were seeing in the first two rounds. It is more like a common cold, but it is spreading. But our residents are doing well, our staff are doing well. They're not out as long. They are recovering quicker and doing much better with what is going on in the building.
That's great. Well, thank you all for your continued hard work and dedication there. And it's good to know that we're headed in the right direction. And Dr. Schwartz, with this Omicron variant, these so-called breakthrough infections have become much more common. What should people do if they find themselves testing positive?
Well, you know, Sandy, each week we have more and more to say about COVID. And now we have four of us on this show today, so you can see how significant things are. I have a nice article that we kind of came up with called Vaccinated, Boosted, and Still Caught COVID. Here's what to do. So I'll just start and I'll kind of read it to you and try to summarize. So they start by saying, with Omicron's ability to glide past some of the vaccine's defenses, experts predict that an increasing number of vaccinated Americans will test positive for COVID-19 as the new variant rips through the country. And even some boosted individuals will be positive on coronavirus tests, although their protection against hospitalization and death from an infection remains strong, which is encouraging. So as you asked, what do you do if you get a breakthrough case of COVID? First thing, and this is the first cardinal thing in medicine, don't panic. So they say, first and foremost, panicking is not advised. In fact, anytime you're in a stressful healthcare situation, panicking probably is the most dangerous thing you can do to yourself. Clouds your ability to think clearly and positively about what needs to be done to get better. And as we talked about, now what's more, evidence suggests that the Omicron variant, which is now responsible for about 95% of new COVID-19 cases, causes less severe illness than its predecessors, although research is still ongoing. So that's encouraging, and that's what Courtney sort of talked to as well about what she's seeing with the residents at MHC. What's the second thing that you do? You talk to your doctor, right? And finding out you're positive for COVID almost always warrants a call to your healthcare provider. A doctor who knows your medical history can help you navigate a treatment plan that takes into account any health conditions that could worsen the infection, like diabetes, heart disease, kidney disease, obesity. There are many other conditions like this. But if you're particularly at high risk for hospitalization, your doctor may want to start you on one of a handful of COVID treatments to prevent the disease from progressing to a dangerous state. And you may know this, but the FDA authorized 2 new prescription pills from Merck and Pfizer that help keep people at high risk for COVID-19 complications out of the hospital. And these oral antivirals are currently in short supply, but expected to be more available in the coming months. And you've also heard about monoclonal antibody treatments, another option for high-risk individuals, depending on the variant that caused the infection. Third thing you do, isolate yourself from others. Catching COVID, even if you don't come down with symptoms, means you need to isolate yourself from others so you don't pass on the virus. So if you're asymptomatic or have mild symptoms, these are newly updated guidelines from the CDC that recommend a 5-day isolation period as long as symptoms are resolving. And of course, this doesn't include loss of taste and smell, which takes a while to return, and as well being fever-free. And then they say follow it up with 5 days of wearing a mask when you're around others. And this decision was based on new data suggesting that people are most infectious early in the course of the infection, around the time the first symptoms appear. And what's more, Omicron seems to have a shorter incubation period. We talked about this in previous shows and means that there's a smaller gap between the time of infection and symptom onset. And they say even if you're symptom-free after day 5, it's been recommended to take an at-home antigen test before rejoining others. And of course, people who are severely ill with COVID or they have compromised immune systems may need to isolate longer, at least 10 days according to the CDC. And the other thing, and this is something we always emphasize, don't forget about the basic healthcare things like washing your hands, improving indoor air quality, wearing masks, still trying to social distance. So we're almost done. Now we're up to number 4. Keep an eye on symptoms. If you're boosted, you're less likely to experience significant COVID symptoms, but you should anticipate fatigue, fever, possibly a runny nose, a sore throat. And any symptoms that you get shouldn't stay for too long. It appears that people who are boosted clear the virus faster, and you may be in for a slightly longer set of symptoms if you're vaccinated but not yet boosted. But if you get to a point where you're having difficulty breathing, you can't catch your breath, you can't stay hydrated, that's where you need to seek more immediate medical attention. And other emergency warning signs include persistent pain or pressure in the chest, confusion, inability to wake or stay awake, high fever that won't come down, pale or gray blue colored skin, lips, or nail beds. We only have to go to number 6. We're at number 5 now. Get your booster if you haven't already is number 5. If you've received your initial vaccine but not a booster shot and came down with COVID-19, it's not too late to get that extra dose. As long as you're 5 months out from your second Pfizer or Moderna shot, or 2 months if for the Johnson & Johnson's single shot vaccine, you can get a booster as soon as your symptoms resolve. And another benefit of getting the booster soon after a breakthrough case, it could lower your risk of experiencing new or lingering symptoms after the illness. And there are some data to support that the faster you get it, the less likely you are to have long-term complications from COVID. And finally, number 6, and this may be one of the most important things, know that your vaccine didn't fail. A breakthrough infection isn't a sign that the vaccines don't work. And this was emphasized by several experts in this article. And they say, while vaccinated people are less likely than unvaccinated individuals to contract COVID, the main job of the vaccines is to prevent death. And the federal data shows they're still doing that. So this is not an indication that the technology behind the vaccine has failed. It's a recognition that it's a brand new organism, a brand new virus that's newly mutated and is able to evade the prior 2 series. The current booster shot seals in an added layer of protection, and it may be the case going forward that another booster is needed. And this is kind of interesting as well. All 3 vaccine makers announced that they're testing Omicron-specific vaccines that could be available as early as the spring. So I know that's a lot of information. There's, and you see how frequently we do this just to try to update you. And this was just a fraction of how much was really written in this article. But again, there's still a lot of encouraging points that we brought up. And I think now is a good time to give you my inspirational quote. I like this quote. It's hard to believe I keep finding them, but this one says, "The longest journey begins with a single step." And that's actually a Chinese proverb. And you know where I first saw that quote? I actually saw that first in the New York Times in July of 1969. So what happened in the New York Times in July of '69? The men walked on the moon. And this was a quote in the New York Times, like maybe 2 days before the men were going to walk on the moon. So, it feels like almost 2 years with this coronavirus. It feels like the longest journey, like it just keeps on and on and on. But each day we take a single step toward to beating it by getting the vaccines, by getting boosters, by continuing to be diligent. And I guess all I can do once again is thank everybody for everything they do every day, their hard work and diligence. And I always end by wishing everybody health and peace. Thanks for listening to me.
Thank you so much, Dr. Schwartz, as always, for passing along those wonderful expert tips and inspiring words for all of us. And Sierra, here at Masonicare, all of our employee team members are required to receive a COVID booster shot by January 31st, which is quickly approaching. Can you remind us about the ways that they can submit proof of vaccination to you?
I certainly can. So I wanted to start off by saying Masonicare has been an industry leader regarding COVID-19 vaccine mandates. And subsequently, Governor Lamont signed executive orders mandating the COVID-19 vaccine series for long-term care workers, and then subsequently for the booster dose. So the Connecticut Department of Public Health had put out guidance that provided a structure for tracking these vaccines. So I will go over 4 ways in which you can do so. So we're required as employers of healthcare professionals to keep this information on record. And one way we can do it is we can collect the CDC COVID card and the attestation of authenticity document. So those two go together, and the reason is because that attestation is basically saying that this card is authentic. Because we know that, you know, in other circumstances, people have forged that. So that is another layer of documentation that for accountability. Second is proof from VAM. So VAM stands for Vaccine Administration Management System. And a lot of vaccine providers will upload that proof of vaccine to that repository. So staff can find their proof of vaccine in VAMS if they have an account. The third way to do it is CTWiz. So CTWiz is the repository that was mostly used for children immunization series documentation. And now it is expanded to include the COVID-19 vaccines for adults. And that is the Connecticut Immunization Information System. And then lastly, proof of vaccine administration can come from the pharmacy. And as long as we have name and date of birth, that will offer enough proof. So if you received your vaccine at a CVS, for example, and you have the app, you will be able to note your vaccine status with either a screenshot or a download of that information. So there are a lot of ways to do it, and the Connecticut DPH website has phone numbers as well if someone is not as tech savvy and wants to find proof via USPS or call somebody for that information. So thank you.
That's great, Sierra. Thank you so much for all of that useful information. And finally, JP, we are keeping some extra safety measures in place in our residential communities for the time being. Do you anticipate lifting these restrictions in the near future?
Sandy, thank you. When we look back, we're actually on day 687 since the start of our task force. 661 days ago, we had our first case of COVID that we battled. And I have to tell you, I am extremely proud of all of our leadership and all of our staff during this fight. And when we talk about the restrictions on the residential living side, we put those in place knowing that the community spread during this time was going to increase. And I'm happy to say because of those restrictions, we're not seeing as much of a spread in our residential living communities, which is fantastic news. History tells us over the past few years that the cases will start to drop, and we actually are starting to see cases drop this week. So my anticipation is we will see those restrictions loosen up over the coming weeks into the month of February. So I do think that's going to happen. But to go back a little bit, Courtney talked a little bit about the fight that they're contending with right now with some of our residents and staff who have come down with COVID over the past few weeks. Courtney, I just want you to know that I can't tell you how proud I am of you and your leadership team and all the staff there who have been fighting so diligently to minimize the spread of COVID, but also those that have it, as you said earlier, the symptoms are very minor. And that's a testament to getting out and getting those vaccines for all of our residents and staff, for our staff to understand infectious control the way they have. But even more so, just the compassion and care that they've provided has been truly amazing. And that's really across our entire system. And I can't tell you, and I know I say this pretty much every single video, how proud I am of all of our staff. It truly is amazing to see what our staff have done during this 661 days of our first case. But what they do every single day outside of COVID to deliver on our mission has been truly inspirational. And I want to thank really everybody. Also, Sierra. You know, Sierra really has taken over a lot of the clinics, and getting those clinics organized and getting everybody to where they need to be for those clinics has been a large task. And I want to thank her personally for doing that. We are getting close to being able to get all those boosters out. As Sierra said, we are really a leader in making sure that that booster was administered to all of our staff before it became a state mandate. And it's really because we knew it was the right thing to do. And it's a testament to seeing, even with the cases that have happened, how minor or minimal they have been in symptoms. So the vaccine is working, and as Dr. Schwartz alluded to his many steps or numbers that he came forward with, it definitely is we're seeing some light at the end of the tunnel, and we are getting very close to that normalcy, as many healthcare professionals have talked about. So Sandy, thank you for allowing me the opportunity to talk to all of the group, and also thank you for our speakers here today. They've are true leaders in our industry, and I am humbled to be part of the team with them.
Thank you so much, JP. That is the perfect way to wrap up our video update for today. I want to thank all of you for sharing your time and your insights with us, as always. And we thank you for joining us once again at home. Until we see you next time, we hope you'll stay safe and stay well.